Hi everyone, today we're doing a lip filler treatment. This patient has never had her lips done before, so she was very excited, but her goal was to have more lips show. So she really wasn't looking for more volume, but she wanted more show, as in if we're looking at someone straight on, she wanted, especially in the upper lip, to have more lift. She also has a gummy smile, so we treat that with neurotoxin. But going ahead and doing a filler treatment is going to just give more longevity to the treatment. Our filler here is going to last about 6 to 12 months, just depending on the patient's metabolism and just how they take to the product, and just depending on the size of the lip the patient wants to maintain. Everyone's a little bit different on when they choose to come in and do a little bit more filler, but it is very important to never overfill a lip. So please make sure when you're, getting your lips filled that you're maintaining, a natural shape. The more product you add in there, the higher risk you are to have filler migration. So here I am just going in with a right angle technique. I'm going in right below that vermilion border. Again, I want to prevent any migration, so we're always treating within the pink of the lip. But in her Cupid's bow area, I did a fanning technique. So I went ahead and placed my product in 3 different retrogrades, but I only used 1 insertion point. So once I achieved a little bit of lift, now I am going in with a standard volume technique to just add in a little bit of, that plump look. The patient, like I said, doesn't want huge lips, but she did just want to work on some hydration, and I just want to fill in and make sure that everything looks very smooth and natural. So I am just placing a couple retrogrades of product, like I said, just using a standard volume technique. And always make sure you get in that corner as well. I just taper my dose there a little bit, just to ensure we have that nice natural curve of the lip. But I'm just going in, tenting. The tenting is just a quick way for me to ensure that I like my depth. I want to make sure that I'm not too deep. 1, for safety reasons, and 2, again, for the risk of migration. We don't want to be down in that muscle. So here I am just doing a quick massage, making sure everything is nice and smooth. There's no lumps and bumps. This patient was getting a little bit swollen, so that's why I took a little extra time to smooth there. I just wanted to make sure everything was integrated. Small lumps and bumps will kind of work themselves out. But you definitely do not want any large bumps. And when a patient starts to get swollen, it's just a little bit harder to tell where you are. So I always tell people, try not to chase swelling too much. Every patient is going to be a little bit different. Some swell a ton, some don't swell at all. So if the patient really starts to swell like this patient did, I just always see them back in 2 weeks. Never kind of chase that swelling. You can see it right above her lip there. And we'll include a before and after picture at the end as well, but she is very, very swollen here. But going ahead and going into the bottom lip. For her bottom lip, I just wanted to do some standard volume. She already had a nice, full bottom lip. We weren't really looking to pull that down anymore, but you can always do right angle in the bottom as well. But for her, we just went ahead and added a little bit of product. If you're adding product to the top lip, you always should be adding to the bottom. Filler is a hyaluronic acid, so it is going to attract water. So you're gonna have this nice, plump upper lip, and if you didn't put anything in the bottom, it's just gonna look really dry in comparison. So even if I'm not looking to increase the size or change the shape, I still do always add a little bit just so we have that product down there to attract that water. So here I am fanning and just doing a nice standard volume, just a retrograde technique, just to place a little bit of product. Again, don't forget about those corners. So I just have her turn away from me. And again, we're always following the natural curvature of that lip and also tapering the amount of product that we're placing. Of course, we don't want, the ends of the lip to be the same size as the middle. That's not, going to give you a very natural shape. So once I have everything placed where I want it, I just go ahead and smooth. Again, like I said, I just want to highlight that she is very swollen. She swelled more than I thought she was going to. And like I said, some people just swell. So I did see her back in 2 weeks, and we did a little enhancement. She ended up needing a tiny bit more on that bottom left-hand side, but everything healed very nicely, and we'll go ahead and put that before and after picture right at the end here.